your thyroid. It may be tiny, but the thyroid plays a huge role in keeping your body running smoothly. From your weight and energy levels to your heart rate and mood, this little gland affects almost every part of your health. And when something goes wrong with it, the effects can be surprisingly wide reaching. In this video, we will break down everything you need to know about thyroid disorders, what they are, what causes them, the signs to watch out for, and how they are diagnosed and treated. Let's get started. The thyroid is a butterfly shaped gland located at the front of your neck, just below the Adam's apple. It plays a vital role in regulating your metabolism, energy, and hormone balance. When this gland does not function properly, either producing too much or too little hormone, it leads to a group of conditions known as thyroid disorders. Let's break down the main thyroid hormones T3 and T4. These hormones control the speed of your metabolism. TSH, thyroid stimulating hormone, produced by the pituitary gland, it signals the thyroid to produce more or less hormone as needed. Maintaining a delicate balance between these hormones is crucial. Thyroid disorders usually fall into one of the following categories: hypothyroidism, when thyroid produces too little hormone; hyperthyroidism, when it produces too much hormone; goiter, enlargement of the thyroid; thyroid nodules, growth in the gland, and it may be benign or malignant; thyroid cancer, less common but potentially serious. Each of these conditions come with unique symptoms and treatment plans. Common causes include autoimmune diseases like Hashimoto's and Graves' disease, iodine deficiency or excess, genetic predisposition, thyroid inflammation, radiation exposure or surgery, tumors or nodules. Sometimes the exact cause is unknown. When your thyroid is underactive, symptoms include fatigue and low energy, weight gain, cold intolerance, dry skin and hair, depression, constipation, irregular or heavy menstrual cycles, and slow heart rate. Hypothyroidism can develop slowly, making it easy to miss at first. When thyroid is overactive, you may notice weight loss despite normal or increased appetite, rapid or irregular heartbeat, anxiety or irritability, heat intolerance, sweating, tremors, frequent bowel movements, and sleep disturbances. It can also cause bulging eyes in Graves' disease, a classic symptom. Diagnosing thyroid disorders require a careful combination of lab tests, imaging studies, and clinical assessment to pinpoint the exact issue. Here is how it's typically done. The first and most important step is a blood test to measure your thyroid hormones. The key markers include TSH or thyroid stimulating hormone. This is often the most sensitive marker and usually tested first. T4 and T3. These reflect the actual levels of thyroid hormones circulating in your body. Thyroid antibodies. These help identify autoimmune thyroid conditions like Hashimoto's thyroiditis or Graves' disease. A high TSH with low T4 usually suggests hypothyroidism, while a low TSH with high T4 or T3 points toward hyperthyroidism. If your doctor suspects a structural issue like a nodule, enlargement, or irregular texture, they may recommend a thyroid ultrasound. This painless imaging test uses sound waves to give a detailed view of the thyroid gland and can identify cysts, solid nodules, or signs of inflammation. In cases where hyperthyroidism is suspected, a radioactive iodine uptake scan may be ordered to see how much iodine the thyroid absorbs. This helps differentiate between causes like Graves' disease and thyroid nodules. If a thyroid nodule appears suspicious or is growing, your doctor may recommend a biopsy using a fine needle. This simple outpatient procedure collects cells from the nodule to determine if it's benign or cancerous. Regular screening. Routine thyroid screening is not needed for everyone, but it's crucial if you have a family history of thyroid disease, live with an autoimmune disorder, recently had a baby, or if you are over the age of 60, especially if you are women, have symptoms like unexplained fatigue, weight changes, or mood shifts. Early detection through proper testing can make a significant difference in managing thyroid conditions before complications arise. If you are experiencing symptoms or are in a higher risk group, don't hesitate to speak with your healthcare provider about getting checked. There are two major autoimmune conditions. First one is the Hashimoto's thyroiditis, the most common cause of hypothyroidism. The immune system attacks the thyroid. Second one is the Graves' disease, most common cause of hyperthyroidism. The immune system overstimulates the thyroid. Both are chronic and may run in families. Now, let's talk about the goiter and thyroid nodules. Goiter means enlarged thyroid, which may be due to iodine deficiency, inflammation, or nodules. Thyroid nodules. Most are benign, but some can be cancerous. Ultrasound and fine needle aspiration help evaluate their nature. Although rare, thyroid cancer is usually treatable. Types include papillary carcinoma, follicular carcinoma, medullary thyroid carcinoma, and anaplastic carcinoma. Early detection and surgery offer excellent outcomes for most types. Now, let's talk about the treatment options. Hypothyroidism is treated with the levothyroxine, a synthetic version of T4 taken daily usually for life. Monitoring and adjusting the dose is key, especially in pregnant women, older adults, and people with heart conditions. When it comes to managing hyperthyroidism, several effective treatment options are available, each tailored to the individual's condition and needs. These include antithyroid medications such as methimazole or propylthiouracil, which help reduce the production of thyroid hormones. Radioactive iodine therapy, which gradually destroys overactive thyroid tissue. Surgery, involving total or partial thyroidectomy, recommended in selected cases, especially when other treatments are not suitable. Each of these options has its own advantages and potential risks. The right choice often depends on factors like age, the severity of the condition, personal preferences, and the underlying cause of the disorder. While not a cure, lifestyle changes can support thyroid health. Iodine balance. It's important to maintain a balanced iodine intake. Both deficiency and excess can harm your thyroid. Selenium and zinc may support thyroid hormone production. Avoid raw goitrogens like too much raw cabbage or broccoli in hypothyroid patients. Regular exercise and stress management. And consult your doctor before taking any supplements. Thyroid hormones are crucial for fetal brain development. Hypothyroidism in pregnancy can cause miscarriage, preeclampsia, or low IQ in the child. Doses of thyroid medication may need adjustment. Thyroid function should be monitored closely during and after pregnancy. Untreated thyroid disorders can lead to heart problems, infertility, goiter or nodules, osteoporosis, mostly in hyperthyroidism, and myxedema coma, a rare, life threatening form of severe hypothyroidism. Timely treatment is essential to avoid these complications. After treatment starts, regular TSH and T4 monitoring is essential. Ultrasound every 6 to 12 months for nodules. Thyroglobulin testing in cancer survivors. Adjust medications during life changes, pregnancy, and weight loss. The thyroid may be small, but its impact is massive. Early detection can prevent long term complications. Most thyroid conditions are manageable with proper care. Don't ignore vague symptoms. Get tested if something feels off. Knowledge is power, and awareness is the first step toward better health. To wrap it up, thyroid disorders are widespread, especially in women. But with the early diagnosis, medical treatment, and regular follow ups, they can be effectively managed. That's it for today. Thank you for watching this video. If you found this video helpful, please like it, share, and subscribe for more medically accurate and easy to understand health education videos. Stay informed, stay healthy. I will see you in the next lesson.